Okay, can everyone hear us?
Mhm.
Okay, great. Ruth, I'm going to turn it over to you.
Thank you,
Yes.
Madam District Manager. So hi, everyone. Good evening. I'm Ruth Mazer, Chair of the Committee of Older Adult Issues, Housing, Health, and Welfare, the mouthful. I wonder if we could just take a minute to each of you to say hello, because we're at such a disadvantage here, seeing all of you in little squares. So it would just be nice to hear your voice before we get started. If you could say your name and where you're from. Hi.
I say Alvarez, Public Health Solutions. I'm here for the committee on.
Yeah, you're in the right place.
Welcome, have a seat.
Have a seat.
Thank you so much.
Have a copy of the agenda. Do we have?
Yes.
Oh, we could just share maybe.
Yeah.
Okay, so is everyone okay with that? With a quick unmute and tell us who you are? And
Sure.
thank you. Who's that?
Carmelo DeBartolo, Community Board 10.
Yeah,
Okay, maybe we'll do members
Okay.
first.
yeah. Thank
How are you?
Okay,
Good
Frank.
evening, everyone.
Okay.
All right, who's next?
Hello, everyone. It's Senya Frangiapani from NIA Community Services Network.
Hi,
Oh,
hi,
thank you for
Senya.
coming. We met you at our last meeting.
I missed you too.
Yes, and CB10 board member. How about Marie? We'll do board members first. Marie.
Hi, everyone. My name is Marie Merville Shazada. Nice to see you all.
Staley, you're on. Staley.
Hey, I'm Staley Dietrich. I'm a public member of the Traffic and Transportation Committee.
Frank, you want to say hi?
Hi guys, Frank's Community Board 10. How are you?
All right. And then maybe we'll just, Stephanie's here. Stephanie?
Hi, I'm Stephanie Simone Mahaney. I'm the chair of the Zoning and Land Use Committee.
Thank you for being here. Okay, now we have some guests also.
Yes, so I'll start. So my name is William Chambers, and I'm from Public Health Solutions, specifically our social care network, and I serve as the Brooklyn Community Engagement Manager for our social care network. Nice to be here.
Thank you.
Hi. Oh, that's okay. You can go.
Okay. Well, Colonel Cantwell is here. Colonel, want to say a quick hi?
Oh,
Hi, good evening, ladies and gentlemen. Thank you very much for inviting me to this forum.
thank you for joining us. We know you have a real busy schedule. It's really a pleasure to have you here. Okay, and we have a representative from Live on New York.
Yes, that's me, Shawnee Aldane. Thank you for the invite being here. I'm the Brooklyn Community Government Affairs Liaison to the organization.
Of course. And I know we have a representative from OHEL here.
Hi, Rena, I guess I'll start. Hi, this is Julie. Thank you for the invite. I'm with OHEL. I'm the program supervisor for Living in Place.
Okay.
Hi, and I'm Rena Shaneholtz. I'm the Assistant Director for Older Adult Services at OHEL, and we're here to talk about Living in Place and a few other programs.
Wonderful. Okay, and we have one more guest from Shore Hill.
I don't think they're here yet.
I'm not here yet. Okay.
We have around the table. Did you want to go around the table?
Sure. Julie.
I'm Julie Thumb, Community Board Member 10.
Hello, my name is Sahil Alvarez. I serve as the Senior Community Engagement Specialist at Public Health Solutions. I'm glad to be here.
Glad to be here.
Hello, I'm Kathy King, and I'm Director of Senior Services and Social Work Services at the Bay Ridge Center.
And Ruth, I want to introduce, I see now online, is Kira Oriana. Lopez. Kira, can you hear us? There she is. So I just wanted to introduce the committee to Kira, who has been Community Board 10's intern, thankfully, because of the Bay Ridge Center, working on the new resource guide and coupon booklet for seniors, for older adults. We had this conversation earlier. We may rename it. And I could just quickly share and just show everyone the front cover that, let's see. Yeah, here it is. Kind of a little bit of an upgrade from last time. It's about 40 odd pages of resource information and local discounts for seniors. And I just wanted Kira to stop in and say hello and just introduce herself, because she's heard so much about everyone and she's here during the day, not in the evening. So Kira, just turn it over to you to say a quick hi.
Hi, so I'm a BSSW student at the College of Staten Island, and I've been interning at the Bay Ridge Center. I've been doing a little bit of work at Bay Ridge Connects as well. And then on Wednesday, I stop on by and I help Josephine with the age-friendly booklet, and I've been doing my best to update it.
She's done a great job. Thank you and thank you for joining us. And if you want to stay so you get a sense of what a committee meeting is like, you're welcome to do so. But I know you're very busy at school. So thank you for joining us tonight. And I don't know if you saw Kathy. Kathy's waving to you. She's here from Bay Ridge Center. Okay, Ruth.
Yeah, great. Thank you for all your work on this. It's really, really appreciated. And I hope you do great in school. Okay, thank you.
Thank you.
Okay. All right, so I don't remember. Do we have anyone yet from Live On New York?
Yes. Live on is here. Shani's here.
Oh,
Yes, I'm here.
okay. So, oh, there you are. Okay. All right. So, it's Shawnee. And Shawnee, could you spell your last name for me?
It's Audain.
Okay. Well, I'd like to give you the floor now so you could speak to us about Live On New York.
Well, thank you. And first, again, thank you for the invite and, letting me come to share some information. I'd also like to apologize in advance for the toddler that is taking a bath in the background.
That's okay.
She's having an amazing time. This is, it's around bedtime, prep. So please forgive the ruckus. But I felt a little concerned about coming to speak to an older adults committee because sometimes they feel like, oh, you're preying and you're preying on us because we're older, and that is not the case at all. Live On New York is an organ procurement organization. We facilitate the organ donation process for about 70% of the state. So anything that happens, within the 5 boroughs, as far north as Poughkeepsie, we handle it. We are responsible. Our CEO likes to call us a logistical company because we are responsible for going into the hospitals. We procure those organs. We bring them back to our facility. We prep them for travel to go to save lives all throughout New York. And some of these organs are actually even going throughout the country. We are working with all the hospitals in our service area. We're not in competition with anyone else. We have we're federally designated, so we have a service area. We've been in service since the 70s. But we've gone from a very poor performing organ procurement organization to now we are top tier in the nation. Over the past 3 to 4 years, we have a new CEO who has taken the helm at Live On New York and has worked really, really hard to work more closely with our hospital partners and transplant centers to make sure that there are more opportunities being investigated and taken advantage of, so more lives could be saved throughout New York. As I mentioned, am a community and government affairs liaison. Brooklyn is my territory for Live On New York. And one of the things I like to say to some of, the older community members that come to my table or are with, in a group when I'm giving a talk, they say, oh, I'm too old, or oh, I'm too sick, or oh, I'm too this, or I'm too that. And no, you're not. Our eldest donor, I believe in history is 98. In New York, I believe is 95. So, and typically that's a liver, someone that's taken pretty good care of themselves, not, didn't do a ton of drinking. So there's an opportunity for us, even in our more advanced age, to be able to save a life. And how I like to also couch the conversation is it's really one of your end of life planning pieces. As you're doing your advanced directives, as you're doing your wills, your trusts, you should also want your family to know how it is you would like to pass away. Live On New York does deal only in deceased donation, so we don't deal in live donation. So it will be, when we all pass away one day, long time from now, prayerfully. But it should be one of your end of life choices. So I actually have partnered with the Brooklyn Borough President and some of the other elected officials and but an organization called End of Life Choices New York. And we worked together to put an end of life program together, a seminar together for not only seniors, but for people really of all ages, kind of middle age, even our 30 somethings that are getting a little up in age. You never know when you're going to pass, especially when you have children. You really need to have all of your affairs in order. It's very, very important. We've had a lot of celebrities that have passed away without anything, even so much as a will on a piece of paper. So we just try to encourage folks to be ready for the end of life. Do a healthcare proxy. If you're not, if there's a lot of people that are not really crazy about formally getting registered to be an organ donor. So I do push the healthcare proxy. I do push having conversations with your family. Yes, sweetie, mommy's coming.
Okay.
I'm sorry. Sorry. I'm sorry. But but yes, that completely jarred me. I'm sorry.
It's funny.
But yes, I try to approach the conversation from as many different angles as possible. Organ donation is saving lives. I did take a look at the few zip codes that you service. I believe there's about 3 of them. I can't remember all of them off the top of my head, but I think it's 28, 09,
09. 09.
and there's one
A
more.
little bit of 20 and a little bit of
20, that was
yes.
it. Okay. So none of your zip codes that you service are high priority areas for Live On New York. So that means that a good portion of the residents are registered organ donors, which is amazing. Within Brooklyn, if I could just share a few numbers with you really quickly, because in New York State, there are about a little over 8,000 people that are waiting on the transplant wait list. Kidney is the most transplanted organ, and most of the people on the list nationally are waiting for a kidney. The wait for a kidney in New York right now is upwards of 5 to 7 years and could be worse than that. So we've got a lot of people on dialysis and one person passes away daily waiting on the transplant wait list, waiting for a life-saving organ. Within Brooklyn, though, of that 8,000, about 1,400 of the people on of that 8,000 reside in Brooklyn. So just to kind of put it, in perspective, I don't want to take up too much time, but I just kind of wanted to bring it and couch it that way that it could be, just end of life planning. I believe on the healthcare proxy, there is a question about organ donation. Does anyone have any questions, any thoughts or fears about being registered or anything you've heard that's crazy about organ donation? Any questions I can answer before I give up the floor?
I guess just how is the registration process for some, because we work with geriatric population.
Yeah.
So if they want to register, how, is it online? Is it in person?
They can do it online. They can come and do it in person. The majority of people register at the DMV. But we've got paper forms. There's an online process. It's very quick. It takes about 3 to 5 minutes, if that.
And I just want to speak to your partner over there, the End of Life Choices New York. We recently used them at OHEL. We have a Holocaust survivor who lives in the city who's made the choice not to have aggressive surgery for her, the cancer that she's dealing with. And the representative from End of Life Choices made the process amazingly easy for her, and she felt so comforted. So, yeah, it's more and more people are making, we do it as a matter of course for our clients, for our programs as much as we can, but he was pretty great. So, yeah, I'm sure that
They're
you're,
an awesome organization. I love working with them. I
yeah.
love working with them. And of course, their work goes a lot deeper. But I love the work they do, and I love working with them. They're amazingly supportive of what we're doing. And we try to support them as well. I'm glad to hear that. Thank you. I will pass it on. Anyone else?
You good?
I know she got cut off a couple times, so I didn't know what she was gonna say, but.
Okay. Any
I
questions?
couldn't hear you.
No, I'm just asking if there are any,
Oh.
I'm repeating your
Oh, okay.
your request for questions, comments, before we let you go to your
My screaming.
little one over there, the wet one.
Right, the wet one.
Yeah.
Oh, goodness.
Water.
Well,
Okay,
thank you.
well-
Oh, wow. She's out of the tub. Okay.
Oh.
Okay, well, thank you so much,
Thank you.
everyone.
Thank you so
Please,
much for
I do
coming.
implore you, please consider being an organ donor. You may be able to save a life one day. Thank you again
you.
so much for the invite. And
welcome.
I hope to join you in person one of these days.
Great.
That would be great.
Okay.
Looking
Thank
forward
you.
to it. Thank you very much for
Good
coming.
night. Thank you, everyone.
Good night. Okay, it's a tough but very important topic. One that brings up millions of feelings for everybody.
Just thinking, can I ask this question? I'm gonna ask it of her, but how do we do it as Jews? Because we get very immediate.
I was thinking the same thing.
Honestly, I'll
You
speak
probably,
to, I'll speak to that as an Orthodox Jew. It is accepted more and more within our community. There's something called, organization called Project Renewal, which specifically deals with kidney donation. I think we're in a new chapter. So, I think it's past, we're sharing a different territory now. Food for thought.
I would also imagine that they do it quite quickly. So I would think it does not interfere with the Jewish burial requirements. Because if someone has passed, they want to get it immediately. So there's no time,
But even the kidney donation, kidney donation is mostly live donation. At least Project Renewal is live donations. Yeah.
Okay. So on that upbeat topic,
Yeah.
but on the other side, it is quite an upbeat topic. It's one of the miracles of our time. And it's amazing. Actually, I'll just share quickly. I have a cousin, 36-year-old guy, in California, in LA, but he just moved to Las Vegas with his family. And he's got 3 kids. and worked through renewal and got a kidney. It was an absolute miracle. And the kidney donor that he got was a former classmate of his wife's. It was just like one of these amazing meant to be,
Yeah.
you know, small world stories. So, yeah, so saved his life. Okay, so now we're going to hear about from Whole You New York City Social Care Network at Public Health Solutions. That's a big mouthful, and I hope you'll be able to explain it all to us.
Yes, and I'm very grateful for the opportunity to be here to discuss what's known as the Whole You NYC. So that is the official name of it. The Social Care Network is what it is. Whole You NYC is the name of it.
Oh,
And
okay.
so, as mentioned, I am the Senior Communication Specialist from Public Health Solutions. And so we are tasked specifically, the communication team. I'm joined by my manager, William Chambers. We're tasked with specifically advertising the Whole You NYC to the borough of Brooklyn. And so I also have some flyers that I could pass up. You guys would like to take a look and
Could you tell us your name and spell it? Well, your first name is William.
So William is my manager on Zoom. I'm
Oh,
the Hill. So
oh.
that's spelled SAHIL, last name Alvarez. And I serve as the Senior Communication Specialist at Public Health Solutions is the organization I represent. And so the Whole You NYC is what's known as a social care network. It was created January 1st under what's known as the 1115 waiver to Medicaid. It's an amendment to Medicaid, which provided over $500 million in what's known as a social care network. And so Public Health Solutions is the lead entity. They are in charge of creating the social care network for the boroughs of Brooklyn, Manhattan, and Queens. But the concept of a social care network is something that is a statewide program. And so there are various organizations throughout the state and even throughout the city that are tasked with creating their own individual social care networks. So as mentioned, Public Health Solutions is in charge of creating the social care network for Manhattan, Brooklyn, and Queens. And so the goal of the social care network is to really invest in preventative health care, right? So addressing what are known as the health-related social needs of Medicaid members. So our primary goal is to screen and provide services to 2.6 million Medicaid members throughout the 3 boroughs in our catchment area. And so the provisions that the Whole You NYC, our social care network, provide are in the realm specifically of food, housing, and nutrition. So for Medicaid members, those who are eligible, once they are screened, what's known as the Accountable Healthy Communities tool, it's a screening tool. It's a 12-question questionnaire. And that is utilized to identify any unmet health-related social needs, right? So if you are a Medicaid member, you can complete that screening, and based off the screening, it asks questions such as, within the last 2 weeks, have you had any concern of where you're going to find your next meal, right? So those kind of questions, they're used to identify any unmet needs in the realms of housing, nutrition, or transportation as well. And so again, the goal is to get Medicaid members access to these services, free direct support services, to improve their overall health state in the end. And so given the committee's theme, I brought the flyer that speaks specifically on the housing support services that are available. So as you can see on the flyer, and for those on Zoom, we just have a flyer here that details specifically within the realms of housing, what the support services that Medicaid members are eligible to receive for free. And so that includes things such as direct rental assistance, utility assistance, removing pest or mold, air conditioner or air filters being implemented. Of course, now in the upcoming months of summer, that is a big concern. And I know from my training as an undergrad student in public health, the biggest natural disaster that causes the most fatalities annually worldwide is actually heat stroke. So high temperatures, and that largely affects our older seniors and then also young children as well. So things such as providing air conditioners and air filters is a necessary health provision that older seniors and all Medicaid members are eligible for through the Whole You NYC Social Care Network. And just again, to reiterate the workflow process, once a member is screened, so we have 2 pathways for getting a member screen. So we have an online tool. So if you were to scan that QR code, you'd be directed to our website where you can fill out that questionnaire. Or the way that our social care network is structured is that we partner directly with a lot of nonprofit organizations. And I see we're joined by a representative from OHEL. So I've been in contact with one of your colleagues, the director of one of the family enrichment centers. So that's just a one example of the kind of community-based organizations that we try to loop into our social care network, because we recognize that these community-based organizations really are some of the best resources to actually deliver those services. So Public Health Solutions is in charge of kind of connecting all of the organizations, but it is exclusively nonprofits that are delivering those resources to Medicaid members. So you can get screened either online or by going into a nonprofit. But regardless, you'd be the Medicaid member who signs up for screening would be receiving those services in the realms of food, housing, and nutrition. Nutrition, housing, and transportation from nonprofit organizations that are within our network. So that's just a high level overview of the social care network and the benefits it offers to Medicaid members. And so please, I hope it's any questions.
What's your success rate in onboarding seniors?
Yeah, so
Especially in our new.
That's a very good question. So as I mentioned, the network went live January 1st. And so we track specifically just our overall numbers. So our end goal for our project date, which is up until March 2027, is, as I mentioned, to screen all those 2.6 million Medicaid members. And as of now, we have roughly 2,000 Medicaid members throughout the 3 boroughs screened. So we don't really collect data specifically on subpopulations, but yes, so we have 2,000 across the 3 boroughs screened in. And obviously within our first quarter is going to be the slower set of numbers. So we're expecting exponential growth because, like I mentioned, we have a 2-year time frame where we're trying to get all 2.6 million New Yorkers who are on Medicaid screened for these services. And we estimate that about out of the 2.6, about 1.4 will actually need these services, will have these unmet services. So we're trying to get services to 1.4 million members. And so that's why we're coming to high level meetings such as community board meetings because we recognize that a lot of times you guys have the pulse on your neighborhood and that direct connection to try to advertise that in the best way that we can. Yes, please.
So are you concerned with all the recent budget cuts to Medicaid that's coming from, up on the top, that this might affect this program?
Yeah, that's a very good question. And full transparency, that was the first question I asked when I was applying for the job, right? Because that's the thing that's on everybody's mind. So I can say that specifically the way that our grant is funded, it is through the Office of Health Insurance Plans, OHIP. So it's a state office, and we've received our funding for our 2-year allotment period. So this is something that will run without hitch up until March 2027. So it'll be no concern of a delay or stopping of services.
I also want to ask, probably a lot of these people live in these NYCHA buildings.
Yes.
Where there's a lot of issues, right? How are you getting into, because there's building issues, like for example, you mentioned the mold and the pests. You can go to somebody's apartment and you can take out, try to eliminate, but if it's a problem in the building, there's infestation. How how is the person's apartment really going to be, taken care of when it's in a building? You don't take care of the entire building, I assume, right? You're taking care of the person who has the Medicaid, right?
Yeah, so that's a very good question. And so specifically, one of our housing partners would be have a little more insight. So as I mentioned at Public Health Solutions, we're really connect different organizations. So we have, for example, Housing Works, and a variety of nonprofit organizations that are specialized in these housing services. And so the way that our services are delivered is on a case-by-case basis. And that is just because of state regulations to make sure that we're addressing the individual need. And so, like you mentioned, if there are many Medicaid members within an entire housing unit, each individual Medicaid member would be receiving services, which could further the overall health of the building drastically, or make some type of impact. But due to state regulations, we have to focus specifically on service delivery on a case-by-case basis to making sure that we're delivered directly to Medicaid members.
So if somebody doesn't have an air conditioner, let's say in a NYCHA building, you could get them, if they're on Medicaid, you
Yes.
could get them an air conditioner. So assuming that they have proper electricity, proper, outlets to accommodate it, you can get that. for them.
Yes, so and those are free services that our organization, our CBO, we like to call them community-based partners, that they provide for Medicaid members.
Right. Ruth, you have a question on Zoom from Senya? Senya?
Thank you for pointing that out to me.
Hi, Josephine. I'm sorry, I didn't quite catch the gentleman's name. Is it Alexander?
It's Sahil.
Sahil.
Oh, Sahil, I'm so sorry, Sahil.
Probably
Okay, so quick question. So what happens, did you say just for Medicaid? What about recipients that have Medicaid and Medicare? Do
Yes.
they still qualify, or is it just strictly the 1115 waiver?
That's a very good question. So if they are on joint Medicaid and Medicare, that'll be on a case-by-case basis. And so it's very important that every member gets screened as well. So for all Medicaid members, regardless of, we have two sub pools. So if you are on Medicaid, you are immediately eligible to receive a screening. So if you have a joint program such as Medicaid and Medicare, that is going to determine what type of services you receive, but it's not going to disqualify you from receiving services at all. So as I mentioned, all of our services are conducted through our community-based organization partners. And so if you are on a certain plan of Medicare, which is all done internally, right? So it's never the expectation that a Medicaid member, when conducting screening, is going to have to decide or know themselves what plan and what their eligibility is. But once you can complete that screening and there is unmet needs, you're going to always be directed to some type of existing services for support. It's just a question of what type of services, and that is going to be determined by their specific plan, if that answers the question.
Okay, and now one other thing, let's just say hypothetically, the client falls outside of the realm of nutrition, housing, and transportation. Hypothetically, for example, an Alzheimer's patient, but they do have Medicaid. Can they qualify for this program?
So yeah, if they have an unmet need in in one of those areas, they would get those needs addressed. So for example, if that hypothetical member, if they are suffering, if they need, let's say, for example, with Alzheimer's, they may have specific nutritional needs. So we have services that are what are known as clinically tailored and medically appropriate meals that many of our nutritional partners provide. So if when filling out that screener, if because of their chronic disease, whether it's Alzheimer's or something like diabetes, a little bit more specifically, they can get clinically appropriate or medically tailored meals through one of our providers. So that's the benefit and importance of the screening is to flag, does this Medicaid member have an unmet need that Medicaid through the network can provide to them.
Okay, thank you.
Thank you.
Okay.
Yeah, any other questions?
You don't service Staten Island, do you?
So yes, so for Staten Island and Bronx, there are different organizations that were elected as the lead entity for those two different boroughs. So for Staten Island, there are social care networks that are implemented, but they're by distinct organizations. So for Staten Island, that is being handled by what's known as SIPS, a public health institution known as SIPS, and for the Bronx, the organization is known as SOMOS. But they do have social care networks that are providing similar, if not the same services. It's just Public Health Solutions. It is not the lead entity.
Gotcha.
It's a very good question.
And just a request, just because we work so much with our program and we link clients to different resources, would it be possible to send in flyer or send it to a chat or email or, not only your program, but everyone else? So we kind of, I'm not sure if this was discussed before, but just to have information so we can make referrals.
Yes, absolutely. My colleague William Chambers, he'll definitely drop the best contact information, and we can also, as I mentioned, primarily the target audience was Medicaid members, but again, we are still actively recruiting nonprofit organizations into our network to provide services to Medicaid members as well. So we can definitely schedule an independent meeting with OHEL to discuss any type of future collaboration. And then also, yeah, I don't know if you have the functionality to be able to drop my email into the
You could, yeah, just tell me your email.
chat. Yeah, so it's S Alvarez ALVAREZ
Uh-huh.
at healthsolutions.org.
Okay.
I'm sorry, I think that was a direct message.
Oh, it is. My goodness. I couldn't see that. It's so small. Okay, I'll do it again. There we go. Okay, everyone should have it now.
Okay, well, thank you for that
Thank you.
information. This
Thank
is
you
all
all.
very new to us.
Platform, thank you.
It's all very new and it's really a lot to absorb.
Yeah.
So I look forward to reading more about it
Thank you.
also. Thank you very much for this. Are there any other thoughts or questions for Sahil here? Okay, so if not, we'll move on. Do we have a representative from Shore Hill?
I do not see one on,
Oh, okay.
but so move on to all help.
Okay, so we'll be moving on to OHEL. And I know we have two different speakers from OHEL, so that's
Well,
great.
We're partners in crime and we'll share the wealth, we'll share the job. I guess I'll start. I'm Rena Shaneholtz. I'm the Assistant Director for Older Adult Services at OHEL. OHEL,
Dana, could you spell your name for us so we have it?
sure. Actually, yeah, it's Julie, you want to put it in the chat for me?
Yes, your name or
My name and
both?
my contact number.
Okay, sure.
Julie will do it. Thank you. I thank you, Julie. I appreciate it. OHEL started back in 1969, and the focus really was on foster care, removing children from abusive homes. Over the many, many years since then, OHEL expanded. We have two mental health clinics, one in Brooklyn, one in Far Rockaway. We have other services that provide housing and day programs for people with mental health and developmental disabilities. We have a domestic violence program. We have a camp for abled and disabled children. We have multiple trauma centers. And about 20 years ago, our director started in the arena of geriatrics. And now we have a lot of programs that serve people 55 plus in the community, Brooklyn, really all 5 boroughs, but I guess we're going to talk right now about what's available in Brooklyn. So that's the OHEL commercial. OHEL is actually a Hebrew word. It means tent, open like the tent of Abraham, open on all 4 sides. Anyone who needs help can come and get it. It's a huge social service organization. I guess the first program we're going to talk about is our Living in Place CTI program. I'm going to let Julie start, and then I can, jump in before we go to other programs.
Thank you, Rena. I was just attaching your email. You're gonna give me a second. So this program is called Living in Place. It's a critical time intervention program. So one of the criteria to enroll to our program is, as we said, 55 and older, and the person needs to have a documented mental health diagnosis. Now that diagnosis can be provided in form of a letter from a doctor and can be stretched to include PTSD, severe anxiety, major depression, bipolar disorder. We serve both Brooklyn and Staten Island. So we first conduct a thorough home-based assessment. And then we proceed to connect the individual with as many services as possible. That's why I mentioned we need every resource, available if possible. While we do not provide the counseling, we do establish a personal connection with the individual. We do this through home visits throughout 6 to 9 months of since the individual enrolled to our program. So the services are very much tailored to different clients because the needs are so different. So we serve as anchor to our clients. We help them go to the doctor, tour a social adult day program with them, navigate the enrollment there, play chess with the client. This is something that our wellness specialist does, and that's a form of connection that she formed with the client. It's worth mentioning that this is a free program, and the only criteria is, the age and the diagnosis. For the referral, we would need, they can refer through access or calling OHEL or contacting us. We basically need name, address, phone number, date of birth, diagnosis, and just a general sense of what the client needs. So this pretty much sums up our services with Living in Place. Irina, did I leave anything out?
No, I think, you said it perfectly. I mean, it's each person had, if you've met one person with a mental health issue, you've met one person with a mental health issue. The benefit of us going in, obviously, even though we're not providing the counseling, we've provided the counseling with other programs that we've had through the years. So we know what we're doing. We're all licensed professionals, mental health professionals. Going into someone's home is very humbling, seeing how they live and what their needs are, whether it's food insecurity, whether it's navigating bill paying, whether it's connecting them to medical services, whether it's connecting them to cleaning services, trying to give them dignity, trying to help them literally live in place to avoid, future hospitalizations. The person that Julie was describing was really a man living in our supportive housing program, and his staff truly didn't know what to do with him. Just our wellness specialist who literally engaged him, played chess with him, took him to the doctor, looked at social adult day programs, certified his Medicaid, things of that nature. He's living his best life. He was practically nonverbal when she started with him. And now he is so opinionated. He is so happy. And it's just really, we help people one at a time based on their needs, as long as they have that specific diagnosis. So it's really a treasure. It's a great program. It's absolutely free. Having someone come to your home for the better part of 9 months is just, it's just such a gift. And we also have a small amount of wraparound funds that we can help to provide anything that will help them for safety, safety measures in the home, or even, I guess, to provide social connection. Or if they need transportation to a day center, or they need transportation to the doctor or other things, we can help in a variety of ways. So that's that program. Any questions about that program? Okay. Good. So now I'm going to talk about another program that we have. Serving Our Survivors. It is a program that literally serves Holocaust survivors and their families. We have plenty that live in the 5 boroughs. I mean, they are very old at this point. The survivors themselves, they're all home-based visits. And we even have a 100-year-old, just going on a weekly basis, helping him work through his trauma and some of his memories and nightmares. He used to tell the clinician when she was leaving the house, thank you for helping me get my life together. If you can start doing that at 100 years old, then God bless you. That's great. And we're there for it. We have a woman who was in an abusive marriage. Her first husband passed away after the war. She was also a survivor. And her second husband was abusive, and she was ashamed to tell people that she was in an abusive marriage. And at the end, our counselors were helping her to try to give her strength and encouragement. And she finally made the decision at the age of 90 to leave the home, to move into an assisted living. We helped her throughout, helped her transition, and she got off the medication. She gained back the weight she lost. She's truly living her best life still. And she will tell anybody, she said, I'll talk to any woman who's in this terrible position. And if I could do it at 90, they can do it. And we were there to help her through that time. So that's just an amazing gift on our, for us as well, that we can still help people at that age. So that's provided in all the boroughs, for anyone who needs that. Um, we also have a pooled income trust. We have the Lifetime Care Foundation, and they have a pooled income and asset trust. And for those of you who don't know, if you need to be Medicaid eligible, the Pooled Special Needs Trust are there to help, could be for individuals with disabilities to maintain their eligibility for Medicaid and SSI. And the money is in the trust is not considered part of their asset, so it won't affect it. Or somebody who, let's say, just needs to be Medicaid eligible that doesn't have a disability, they just need to be 65 and older and have a medical, issue, which most older people have something, and they can put money into a trust to be Medicaid eligible so they can live their best life. Sometimes older parents have children, adult children with diagnoses with developmental disabilities, and they say, who's going to take care of them when I'm not here anymore? We can't be the parents, but we can certainly help them to navigate, their lives. And the trust can pay for things like even not just bills, could be maybe they want to go on a vacation, maybe they want to fix something in their house. It's so wide and it's so big. There's no minimum. Some trusts you have to put a minimum of $100,000 in. Our trust, there is no minimum. It's only $1,100 a year. We do a free home assessment for any senior. You can call, we can go into the house. We can ask them about all of their needs for free, even if they don't sign up with the trust, which is a very good service as well. And if they want the trust, great. Maybe they need other services within OHEL that are free. We always try to, push the free programs, because why not? We're here for it. Our pooled trust is the pooled trust with a heart, because it has this huge social service component behind it. And we have a lot to offer the community. So Julie, I think put my name, email, phone number, and hers as well. And if you have any questions, please shoot.
You're not connected with Jewish Family Services at all in any way, are
No,
you?
no, but if we can't help somebody, we'll make the referral.
Because my parents live in Florida and and they're survivors, and we deal with JFS.
Oh, okay, influence.
So I was wondering if the services were similar. I don't know all the services of JFS, but
Right. I mean, probably. It's funny. I just attended a Holocaust conference at the Morse Center in.
yeah. More
Yeah.
center, more Center for Life. Yeah.
Yes, it's an amazing. So Dr. Irit Felsen gave a wonderful lecture. Obviously she's the trauma expert. Our support groups are based on her life's work. So we got a little bit of a tour of the tremendous work that they do there. So we're not quite as big, but it would be nice to be one day, because it's really honorable work. It's like God's work to take care of our survivors and to give them dignity and quality of life. So we also have 22 satellite clinics in the 5 boroughs in senior centers. Julie actually worked in one of those programs before she came here.
So I worked with Bay Ridge Connects through Weill Cornell as a clinician.
Right, and that's where we met you when we did the health fair. And that's
social work health fair. Yes, that's where we met.
Yeah, that was a great health fair. Yeah.
Wonderful to hear.
Yeah, so it was lovely to meet everybody. Thank you for having us.
Well, thank you for bringing us all this information. OHEL keeps growing. I know it's a huge and wonderful organization.
On Avenue M. Is it, because I see the sign for OL on Avenue M?
Yes, that's our main
Across
office.
from Yellow Door, my favorite store. Yeah, okay,
Exactly.
so I know where you are. You're on that.
Okay, so come find me. Don't be a stranger.
So I'm there a lot.
Okay, we can have office hours in the yellow door. That's therapy. That is therapy.
Yeah, tell me that. Not to be confused with the Oh Hell in Queens.
Correct, correct. The Lubavitcher Rebbe is not buried in our building, correct.
Okay.
Okay, so we certainly had varied kinds of presentations. And we wound up having 4 presentations.
Yeah, I did check to see if Shore Hill, I don't see anything, so something must, yes, hopefully it
They'll
was
come at
okay.
different
Yes,
times.
we'll invite them back.
Yeah, definitely. And I'd like to invite all of you, if you'd like to join in for future meetings that we have. We can let you know. You could check the agenda, see if it's something that appeals to you.
Mhm.
And we will be presenting a synopsis of all your presentations at our full community board meeting, which will be on May 19th. And that way, what you're telling us goes further to the full board and any community members who decide to come or to listen online. So I want to thank everybody for making these wonderful presentations to us. And of course, for the work that you do every day for our seniors and people in need in the community, and for enabling us to learn more about what it is that you do.
Thank you.
Our community members and our board members coming tonight.
Thank you.
That includes you.
Yeah.
It is great to be here.
We had one more item.
Oh, yeah, I'm not adjourning.
Oh, okay,
I'm
good.
just-
Yeah, thank you. Okay,
I'm
thank you.
just, babbling. Okay. So moving on, do we refer to this as new business or?
It's on the agenda. We put it on the agenda, so the next,
Okay.
make it another item.
So at our last meeting, at our last full board meeting, under new business, somebody brought up a board member brought up a proposal that was written by a few board members, and it was a request for the board to approve of their interest in sending a letter to federal and state representatives opposing potential budget cuts to our local VA hospital and the Fort Hamilton garrison. So there were some responses to this proposal, and it was decided that it had to come to a committee first to be discussed. Rather than just have a motion made, approve or not approve, without it really being looked into and discussed. So I just would like to add that there were some people at the meeting who felt that it was not appropriate for a community board to make a recommendation to people on the state or federal level, because we are a part of city government. And of course, there were people who felt otherwise. So I'd like to bring this to the floor for discussion. And I'd like to hear from committee members first, and then we'll open the floor to everybody. I'd like to hear your thoughts about having the board, the full board send out this kind of request. Any thoughts?
There's no reason we shouldn't. This is totally in our wheelhouse, unless Josephine, you could tell me that it's not traditional for a community board to involve themselves in these matters. But as representatives of our community, not elected but appointed, these institutions being part of our community, both economically and for jobs and our neighbors that live here, we have every right to send a letter to our electeds at the federal level, the city level, and the state level, and ask them about these cuts and how they're going to impact us and how they're addressing them.
Yeah, so to your question, Carmelo, we did, look back, and certainly the board has been, has asked to write letters, and typically, the board as a city agency, mandated by the charter of the city of New York, we have a section in the charter that speaks to the general role of community boards. And it's, some sections are specific, some are vague. But day to day, we do deal with city agencies. We handle all agency requests. We have liaisons with city agencies, not so much in federal or state. We usually make those referrals. But the charter, in looking at it with, some of the members who have been here a while, does have a broad section that says that we can consider the needs of the district, which it serves, that we can cooperate and advise any public officer with respect to any matter relating to the welfare of the district and its residents. As far as, getting specific information on proposed cuts, it's very different on a federal and state level. That information doesn't always come directly to us. We rely on liaisons with legislative affairs, and public affairs. So we don't readily have those liaisons. So a letter that is broad enough that, advocates for the residents of the district, the welfare of the district, to our federal representatives who do have that information, who are working on these matters, and our state elected officials who are working on these matters. In speaking to the chair, we, feel that it's entirely appropriate to advocate and support those who are concerned about this matter and its impact to the residents of this district. So in that sense, writing a letter to, our federal and state elected officials is, in that context, is okay. As far as briefings here, it becomes a little bit more, difficult to get agency heads from those agencies because they don't report directly to the community boards. Like the city agencies do, we have liaisons in every city agency, because that's our mandate for the charter. So that's kind of my simple response to that.
But then the city agencies have connection to the state and then the state to the federal, correct?
Right. Internally, there are different divisions within agencies that have, especially if there's funding that's derived, that trickles down to the city agencies. The community boards themselves only get involved in the review of service delivery, specific to the agencies of the city of New York, right? So we have the district needs statement each year. That's a compilation of looking at data, across the district, how many calls are being made to 311, how many requests are, made for any agency delivery service, how quickly are those responded to, advocating in the city budget. And of course, the city budget does get federal, resources, does get state resources, and it is impactful. But realizing our mandate and, our staffing levels and our interactions and the breadth of our service, this is more, I think, of a general request to say, hey, as I understand it, we're concerned about the potential impacts. We have lots of people within the district who, work at the VA hospital, receive services at the VA. Certainly, we're one of the only community districts that actually have the Fort Hamilton Army Garrison. So happy to have the colonel here today. And we do work closely, as a community together So, James, the chair felt very strongly that, the appropriateness of this type of letter and did want it to go to committee because that's how we do things. As a community board, we don't meet outside of the board realm. We should meet within the board realm. And that was and I think that was some of the confusion that evening, is that it was at the end of the evening. It had not been discussed in committee before members of the appropriate committee, which in this case is the Older Adult Housing, Health and Welfare Committee. So I think I've said enough, Ruth. I'll turn it back to you. So I think you just need a second, and if you want further discussion, a vote.
You need a second for a motion? Was that a motion?
No,
Okay.
you mean what Josephine said?
No, what I said wasn't a motion, but
That's why I
but
said,
writing a
thought you
letter
said
would
you
need
this. Oh, writing the letter would need a second.
would
Didn't
need
they
a
have a
motion.
letter? Do we have a copy of the letter?
We need a motion and a letter. I think the letter would be a letter to the elected officials expressing concern about potential cuts to the VA hospital and the Fort Hamilton Army Garrison.
Yeah, a letter was written.
I think.
Yeah, I know. Do we have it?
Oh,
Because
so
it was good.
Yeah, do you mind reading it for people who did not hear it?
Yeah, I mean,
Yeah.
I'll read what was presented that evening. We don't have to send this in this form with these exact
Of course
words,
not. Of course not.
but I'll read what was presented the night of the board meeting. We're writing to express our ongoing concern for recent aggressive and haphazard cuts to our federal workforce. The bond between Bay Ridge, Dyker Heights, and the federal government is especially close. Every day, hundreds of people go to work at the Brooklyn Veterans Affairs Medical Center. These dedicated public servants have been caring for our city's veterans since 1950. We believe that their work is invaluable to our veterans, and the Brooklyn VA's commitment to service reflects our own deep gratitude for their service. We are also deeply grateful for the soldiers and civilians keeping our country safe today. Several hundred are stationed at Fort Hamilton, the only military installation in the city, and an institution that has been part of this community since the American Revolution. Each and every day, these men and women are working hard for all of us. Recently, the president expressed his desire to cut 80,000 workers from the Department of Veterans Affairs. He has also directed his Secretary of Defense to make deep personnel cuts. Undoubtedly, such cuts will affect our own Brooklyn VA and Fort Hamilton. The board respects our federal workforce and believes in due process. Every federal employee makes a valuable contribution and deserves to be evaluated on his or her own merits, not summarily dismissed in the name of efficiency. We urge you to demand that this administration proceeds carefully and transparently. The soldiers, doctors, nurses, and others serving our nation at the medical center and Fort Hamilton deserve no less.
That's a great letter. Sorry. I think that's a great letter.
It is a great letter, I agree.
If I had written the letter, it would be just a bunch of characters from my screen, because that's how annoyed I am at the whole process that's happening. But I think that was well written. And there's a couple of words I would change, not to make it so antagonistic. But with all the information presented in that letter, we would have to include in a letter, I would think. The historical background, the historical information, the amount of people working at the VA hospital, the amount of people stationed at Fort Hamilton, all information needs to be on the letter. They need to know that we know what's at stake and we want to know what's going on.
So then are you saying the first step is for us to reach out to the appropriate legislative units of both the VA hospital and I guess it would be the Army Garrison? There are intergovernmental units within those entities that we can get that information.
No, I thought that the letter had enough information.
Oh, okay. I thought you wanted more
For a
specific. I thought you were saying
No,
you
not
wanted
at
more
all.
specific.
I think the letter does the trick. There's a couple of words I would change. Of course, the
But you
antagonistic
understood what I was
nature of the
saying.
letter I would change too. But I thought the letter encompassing all that information was very good.
I don't think it was antagonistic. I think it was direct. You know, it kind of got to the point my opinion only,
I'm
but.
being so nice right now. Help me. If it was me written the letter, there'd be a lot of F's all over it.
Oh, well, yeah, me too. I'm like you. But I think it was really well written.
I'm somewhere where it's
Thank
kind of
you.
hard to speak, but like I've been putting questions in the chat. So like, who wrote the letter again?
I think Staley, did you write that letter?
I think
it was,
Dan.
oh, it was Dan. Dan's had, he presented it, but he said a number of board members
It was
got
a
together.
it was a Staley, Dan, and Jack Zhang collaboration.
Okay.
Okay, thanks.
Okay.
Nice job.
Okay, thank you.
Yeah.
No
really.
problem. I was just going to make a comment if you guys don't mind. I apologize. I actually have to leave in a moment anyway, to go to another meeting. But I wanted to point out that I think that now is is definitely still the time to send this. And I'm not sure how everyone pays attention to this, but the Secretary of Veterans Affairs was just on. Just in front of the Senate like 1 or 2 days ago, and actually already under a little bit of pressure from senators for the cuts that his department's attempting to make. So if this letter can kind of add to that pressure on those people in the administration, I think it's a good thing to do.
I have to say, I thought at first the letter was like more like included even more than just talking about Fort Hamilton, and that's why I put a link in there talking about what the Medicaid cuts would do to our area if there were Medicaid cuts. But now that I heard the letter, I understand it's very specific and targeted, which I think is great because there's lots of things we could be concerned about, but this is very specific to our area. So I think it's great.
Motion?
So we would need a motion, a second, and then a vote.
Are there any
I'll
other
make,
feedback about following up with the letter? No? Okay. Then would someone like to make a motion?
I'll make that first motion to accept the letter with minor changes, if any are required.
What kind of minor changes are you proposing? 'Cause
I thought there was a couple of words in the onset that just comes out swinging, and when I write letters, I don't come out swinging. I may go out swinging, but I don't come in swinging. But I thought it was a great letter. Like haphazard, that stuff's good, but just want to make sure that that's what we want. We should all, if we have a meeting, a general board meeting, and we're going to present the letter as is, then everybody should have it in their hand.
I'll
And make sure
second.
they.
Whoops, I'm sorry. I'm seconding you, Carmela. It's Danielle.
Thanks, Danielle.
Okay, so now we have a motion, we have a second. Do we have any more discussion? Okay,
Okay, so I will call the vote. All in favor of the motion, which speaks to making a couple of minor word changes and sending out the letter. All in favor?
Aye.
So how many are in favor?
okay,
Carmela?
1, 2, 3, 4, 5.
I am.
1, 2, 3, 4, 5. Okay, any opposed? Okay, Frank? Okay, Senya, how do you vote? Or Dr. Ramawi? I don't see, and I know Stephanie, you're not on the committee, so I think we lost them. Okay, so that was 1, 2, 3. 1, 2, 3, 4, 5. Five in favor.
And how many opposed?
1 opposed.
One opposed. So we must have some abstentions.
And then Senya and Dr. Ramawi, how are you voting? They may have walked away or then,
Right.
so we can ask them later, I guess.
Or put them down as
But as
abstentions.
abstentions, okay.
Do we have a quorum with the
Yes.
votes? Okay.
We have a, yes, Danielle, I have you. So it's 1, two, just three. Well, right, so it's 5 in favor, 1 opposed, and we're gonna put down 2 abstentions. And we have a quorum, but not an in-person quorum, so this would need a second on the floor at the board meeting, okay?
Okay, thank you.
I'll make, those changes to those words that you mentioned, Carmelo, and
You
then,
know, that was like the first opening sentences.
yeah, I got
And
it.
it was, and it's good. It's just, we want to make a point.
Right. Understood, okay.
Okay, any, old business anybody wants to bring up? Okay, moving along, would someone like to make a motion to end the meeting?
I'll make the motion.
Hey.
Right.
Thank you.
All in favor, okay.
I don't usually like to make motions, but